episode is very important. It's one near and dear to my heart. I hope that mothers, daughters, aunts, grandmothers, and women of all ages will sit down and actually really pay attention to this message because it's something that affects us all. My first guest is Dr. Amsu.
Hey, how you doing?
I'm doing well. And you, Dr. Amsu, are a part of the Electric Docs.
Correct.
And you all have a new campaign called Kill the Pill.
Yeah.
Tell us why it's so important that we as women kill the pill. And by pill, we mean the birth control pill.
Right. We use the pill because that's the most common form of birth control that doctors prescribe to young girls. It starts up at a very young age.
Absolutely.
So the reason why we want to spread this message is because young girls, teenage girls, they don't know what they're getting themselves into.
Yeah, well, we
their
think
parents,
that,
right?
Yeah,
their mothers or whoever their guardians are taking them to the doctors for whatever reason.
Right.
Whether they don't want them to get pregnant or they have hormonal acne, they have bloating, irregular menses, any of these reasons, they take them to to see a GYN or just a normal practitioner, and they say, okay, you want to try this. They give them the pill, and it does give temporary relief, but at
risk?
At a risk, with some form of side effects. And most women or girls, they don't realize that it's the pill causing these chronic issues that follow on later on.
We've not been taught this. And I know I got on birth control pills when I went to college.
Right.
So I was about at 17 years old. And then later, I remember people telling me my daughter had severe skin issues. And the pill was something suggested, not because she was sexually active, but for something that kind of could help with puberty, because sometimes girls have irregular periods or they're, like you said, acne. And this is something that we've been kind of taught to use as a way to kind of regulate puberty almost.
Right, right. And the way how it works is the pill is full of estrogen and progestin. They are synthesized form of estrogen and progestin, which is a synthetic form of progesterone.
Wow.
And it basically tricks or fools the pituitary gland into believing that the female is pregnant. And the way it does this by bombarding the pituitary gland with estrogen.
Okay.
So what it does in effect is basically stops producing follicle stimulating hormone and luteinizing hormone, which triggers or initiates ovulation.
Okay.
Okay. So by doing that, the body believes, lady's pregnant. So we're going to stop producing this, this hormone.
Okay.
So that's the principle of how it works. What actually happens though is that over time, this estrogen being pumped in, and remember, estrogen and progesterone are steroidal hormones.
Right.
They're steroids. So the body being bombarded with this steroid, and it's not an anabolic steroid. We're used to hearing about anabolic, which is, what weightlifters use.
We aren't used to hearing about anabolic, so we...
Oh, anabolic.
Layman's terms, we don't know what any of that means.
Most people hear about steroids. You see a guy and he's built and he's on steroids.
Right.
But this is the truth.
Okay.
Most women are on steroids more than men are on steroids, because women who take birth control in any shape, size or form, they are on steroids. So steroids affect the body to the nth degree. Right? It exaggerates.
Because we hear that mood swings.
So the mood swings that come with it, depression. So estrogen is a catabolic steroid. It's the opposite of an anabolic steroid, which anabolic builds muscle.
Okay.
Catabolic breaks muscle down into fat.
Oh, wow.
So it actually causes weight gain. So a lot of girls who are underweight, they're told, take the pill. This is going to give you a booty. It's going to give you some, some breasts and whatever. So they get onto the pill to nothing.
Wow.
So a lot of, a vast majority of women who are on birth control are not on it for contraceptive reasons. They're on it for these other reasons.
For other reasons.
Not knowing what the aftermath is going to be.
Well, I want to stop you right there, because you just said a lot. And I think that for those of us that don't understand the medical terms, what I did understand very clearly is that this is the equivalent of steroids. And we look at steroids as something that can change people's moods, can affect their health, but in essence, we're putting our daughters and ourselves on steroids, something that can affect their mood swings, and it's actually doing something to our body. So what happens to a woman if she's been on birth control from the time she's 16, or some girls as even young as 13, and now she's at an age where she's wanting to have a baby?
All right, so when you stop using something for a period of time, it atrophies basically. Atrophy is basically not going to work anymore.
Okay.
So years after being where your body is not ovulating, your body is going to forget how to ovulate. So ovulation will not take place. So infertility among black women, you sneeze on a black woman, she's getting pregnant some years ago, right?
Right.
Now, over the last 20 odd years, you know, the increase, like, you know, a third of black women are now infertile. That's crazy. Those are crazy numbers. So this is the long-term aftermath effect. So you also have depression, right? Depression. You said about the mood swings. The birth control pill actually atrophies parts of the brain.
Wow.
Where, you know, stimuli for different different emotions, that goes out the window. So I might tell you a joke, the best joke in the world, funnier than Kevin Hart, I've been told, right? And you wouldn't even laugh because you don't know how to respond to it. So these are the things, suicidal thoughts. A lot of women who are on long-term birth control become suicidal. So the side effects are, you know, just on the neurological and psychological part, it's devastating.
Wow. Well, we definitely, I want to get more into this because that is something that I think that women need to be educated on. Even if you do choose to use the birth control, you should know exactly what the pills are doing to your body. So we're going to come back after break, and your partner's going to join us and talk about how this and other issues are causing infertility rates in women across the world. You guys, please join us when we come back in just a second. We're talking about kill the pill and why it's really important that women are at the very least educated on what the pill is doing to their bodies. Now, you mentioned other forms of birth control, but I just want to make sure that we're clear because a lot of women are using NuvaRing. They're all different, there's a shot that they can give you. There's all types of different forms of birth control, but they all, absolutely, they all use
implant and and you have to understand that things like Depo, which is the injection, it lasts for 3 months. Now, consider this.
I had the Depo-Provera
something
shot.
that lasts for 3 months. We can guarantee you ain't going to get pregnant for 3 months. How powerful is that? How powerful is that steroid going to be that it's going to take out 3 cycles? 3 cycles.
You never think about that. I noticed that when I was on I got the Depo-Provera shot after I had my first child.
Right.
And I gained about 40 pounds over a 6-month period, which after having a baby, I just had my daughter, got the Depo-Provera shot right after coming out of the hospital because I didn't want to get pregnant again. And I was so depressed. I was having mood swings. I was crying all the time. I was really angry, like really just frustrated right after getting the shot. Then it would wear off, and then I noticed I just was gaining so much weight. But I never thought that it could be a steroid or exactly what was happening to my body.
So estrogen perpetuates fat, which we call white adipose tissue. This is the haven for all forms of toxin. So when you gain fat, you're gaining places where bacteria can hide, toxins that you may eat, things that you can't digest properly get stored as fat, first of all. So this actually exacerbates more fat. More fat exacerbates more estrogen. So there's different types of estrogen. When you're pregnant, your body produces estrone, which is, it helps with the placenta and stuff like that. So when you came off now, your body didn't get a chance to get rid of estrogen.
Right.
You just bombarded it even more.
Right.
Just,
well, they tell you to do that so that you don't get pregnant because we know your body is very susceptible to getting pregnant. Right.
And then those same they now have you when you start going through depression. Oh, we're going to give you some Prozac or we're going to give you some other form of medication that you're going to be hooked on. So things like blood clots is a major issue. A lot of women who are on the Depo or on implants, they're doing, they're getting a lot of blood clots and thromboembolism, pulmonary embolisms strokes, mini
Right.
strokes,
Right.
stuff like that. High blood pressure is coming out of that. Diabetes is coming out of that. The number one cause of cancer, breast cancer and cervical cancer, is the birth control.
Right. Wow. Now that's what got me very interested in this, because we're talking about the rise in women, especially younger women, dealing with breast cancer and different types of cancer, but especially breast cancer, and wondering where is this, why is this happening? I have a friend that, is 35, in their 20s, and dealing with breast cancer, and so we know that there's probably multiple causes for that. But on top of the infertility rates, there's definitely something going on, something that is targeting us and making us a lot more susceptible to cancer and infertility issues.
And this is the thing, the World Health Organization, we don't, at the black community, we don't pay attention to what the World Health Organization is saying. So they're telling the whole world that, look, birth control is a group 1 carcinogen.
Wow.
Carcinogen means it causes cancer.
Right.
A group 1, that means it's at the top. It's with the big boys. So we're not paying attention. So when these things, white papers are being released, we're paying attention to love and hip hop.
Wow. He said a mouthful. Well, I can't thank you enough for coming. This obviously is just scratching the surface. This is going to be part 1 of a 2-part series. We're going to be joined next week with Dr. Amsu's partner, Dr. Amun, who is also part of Electric Docs, and we're going to learn more about this. Thank you guys for tuning in. Like I said, we're going to have part 2 of this, but as always, we appreciate you tuning in and watching, and we look forward to seeing you next week.